Hey guys, my name is Natalie Looney and I'll be talking about the mental hospital. It's a total institution where individuals live and work. They're cut off from society and live an enclosed life. Patients are treated as objects rather than humans by hospital staff. Psychiatrist D.L. Rosenhan, he got admitted to 12 different mental hospitals by pretending to be psychotic. He experienced patients treated as inanimate objects. Staff acted as if they weren't even there. Patients also called inmates, just like prisoners. Hygiene and waste evacuation is monitored and personal items inspected at any time. Patients sometimes have like gang showers without any curtains, everyone just all in one room. And there's a lot of sexual abuse, overuse of drugs, and patient neglect is common. Lack of competent psychiatrists is also a problem with mental hospitals. Most competent psychiatrists prefer private practices because it's more money. Most skilled practitioners take care of the most least impaired patients, the worried well or mildly neurotic rich people, not patients at institutes that need them the most. Consequences of staff incompetence and patients dehumanization. Sometimes symptoms indicated to be of a patient's illness is actually a result of the staff's actions. Patients develop hospitalities or institutionalism, which is the inability to function in larger societies. Professional staff members become less capable than mental patients in diagnosing mental illnesses. Two kinds of data about goings on in the mental hospital are qualitative data, which is collected through participant observation, and quantitative data, which is collected through questioning patients. Deinstitutionalized or hospital discharge. Currently, stay in hospitals for mental patients is 2 weeks compared to stays as long as years and decades in the past. Due to this, some of the mental patients are now homeless or in jail. Majority are, however, in state-financed housing or their own homes, receiving treatment in general hospitals, veterans hospitals, or outpatient clinics.
Hi, my name is Cynthia Lopez. I'm in Group 8. I'll be covering the section on Community Mental Health Center for Chapter 8. The Community Mental Health Center offers professional and paraprofessional help to the emotionally disturbed. They do this by network therapy, which is non-professional treatment provided by friends or family, and has been proven to be highly effective with bringing deinstitutionalized patients back to their normal life. Because of network therapy, schizophrenics have rarely been readmitted to mental hospitals. They have lower rates of relapse. They show fewer symptoms of schizophrenia. They're more satisfied with their lives when compared to those who are hospitalized or are under drug treatment alone. Laypersons who provide network therapy do a better job in treating their patients than professional psychiatrists, because psychiatrists can't always relate to their patients on a more personal or social level. Curing a mental disorder requires more than just medication alone. It requires genuine compassion and empathy. The section on perspectives on mental disorder. There are 3 different ways of looking at mental disorder, which are represented by the medical, psychosocial, and labeling models. The medical model defines mental disorder as a disease, so psychiatrists treat this illness by physical means such as drugs, electric shock, and surgery. Psychosocial theory attributes mental disorder to emotional conflict. Psychiatrists treat the illness by using talk therapy to resolve the conflict. Stress theory attributes mental disorder as a result from stressful social experiences rather than actually suggesting how to treat the disorder. Lastly, the labeling model is neither explanatory nor treatment oriented, and is also known as anti-psychiatric because it critiques what psychiatrists think and do about medical disorders.
Hi, my name is Dennis Lopez, and I'll be talking about the medical model the psychosocial model, and the psychoanalytic theory. There are three different ways of looking at mental disorders, represented by the medical, the psychosocial, and the labeling models. The first two derive from the positive perspective, and the third from the constructionist perspective. I'll be talking about the first two. The medical model is one way of looking at mental disorders. It derives from the positive perspective. The medical model defines mental disorders as a disease with a biological origin. It's treated by physical means such as drugs, electric shock, or surgery. Medical and biological psychiatrists point to one of two kinds of evidence to support their belief in the biological causes of mental disorder. One type of evidence comes from studies on genetically related individuals. Another type of evidence comes from numerous cases of successful treatment of mental patients with antipsychotic and antidepressant drugs. So because of these two evidences, we refer to these two as into the medical model. And these drugs treat only the symptoms but not the causes of mental disorders. So the symptoms will stop, but it will not cure the mental disorder. The other type of way to look at a mental disorder would be through the psychosocial model. And this psychosocial model is one way of looking at mental disorders. It derives from the positive perspective. This model can be found in many psychological and sociological theories. And one important theory out of these two is a psychosocial model. It can be found in the psychoanalytic theory. So the psychoanalytic theory is inside the psychosocial model, and this is one out of the two that are most important of theories that are inside this model. And the psychoanalytic theory is presented by Sigmund Freud a century ago. This theory traces mental disorders to some unresolved psychic or emotional conflict in the patient. To Freud, conflict is inevitable within the personality of every human being due to having three conflicting parts: the ID, the ego, and the superego. The ID consists of animal desires for sex and aggression. The ego is rational and logical, and the superego is roughly the same as a conscious. The ID and superego fight over many issues, and each time the ego will try to settle it. If the ego succeeds in resolving the conflict, the child will grow up to be normal. But if the ego fails, the unresolved conflict will develop into a neurosis or a psychosis. The conflict is usually such a painful experience that the patient represses it into the unconscious area, but manifests into either anxiety, depression, or compulsion. This is the end of my parts on the medical, the psychosocial, and the psychoanalytic theory.
Hello, my name is Jonathan Lopez, and I did sections social stress theory, the labeling method, and mental illness as a myth. Social stress theory. Since the early 1980s, there have been many studies on social stress as a significant contributor to the development of mental illness. These life crisis stressors can include divorce, unemployment, death of a loved one, etc. Society can be seen as promoting mental illness in two different ways. The first one by putting some people in more stressful situations, and the second by depriving them of social and psychological resources required for dealing with stress. There are several types of coping resources that have been found effective in the reduction of stress. They include social support, personal skill, and high self-esteem. The labeling method. Advocates of the medical and psychosocial model assume that mental illness is real. Otherwise, they would not bother to look for causes and cures for the illness. A few psychiatrists and many sociologists question this assumption. The constructionist perspective sees mental disorder as a label imposed on some disturbing behavior rather than a sickness. Mental illness as a myth. Psychiatrist Thomas Szasz criticizes that medical model for assuming that mental illness is just as real as a bodily disease. Szasz explains that mental illness is a myth, but does not imply that the behavior labeled mental illness does not exist. He simply objects to the use of a label because it masks as well as distorts the true nature of the behavior by implying that it is similar to a physical disease. He views mental illness as a problem in living. a moral conflict in human relations, or a communication expressing some social unacceptable idea. All these terms imply that mental illness is not a medical term, but a social and moral one. If mental illness is seen as a label imposed as an interpersonal conflict, it shouldn't surprise you that many normal people are being labeled as mental patients simply because they have problems with others. The first edition of the DSM-I came out in 1952, and only about 100 types of different behaviors were listed as mental disorders, and since the number has now jumped to well over 300. This means that reacting angrily to criticism or losing one's temper, which have never been treated as mental disorders, are now included in the DSM-IV and are therefore expected to be controlled. Many psychiatrists are recruited by many social and government agencies to treat or control youngsters whose behaviors offend or disturb others, such as being defiant, using drugs, fighting, hating school, or being disrespectful. Many of these youngsters are victims of poverty, child abuse, or family misery, and their behaviors reflect a normal response to their abnormal environment.